Cardiac arrest is an cardiovascular disease. Look at this picture, shows that echocardiogram findings, CT findings. Look at this picture and ECG. A detail going on. Introduction. Cardiac arrest is a medical emergency that occurs when the heart suddenly stops beating, leading to cessation of blood flow to vital organs, particularly the brain. It can result from various underlying conditions and demands medical intervention to prevent death or severe damage to the body. Etymology. The term cardiac comes from Greek word cardia, meaning heart, while arrest is derived from the Latin arrestor, meaning to stop or to halt. Together, cardiac arrest refers to the sudden cessation or stopping of the heart's normal function. A definition. Cardiac arrest is defined as the abrupt cessation of the heart's pumping function, leading to the absence of a detachable pulse, loss of consciousness, and cessation of breathing. It differs from a heart attack, which is blockage of blood flow to the heart muscle, while cardiac arrest is the result of electrical disturbances in the heart that prevent it from beating properly. Types 1. Ventricular fibrillation (VF), a chaotic rapid electrical activity in the ventricles, preventing them from contracting normally. VF is the most common cause of sudden cardiac arrest. 2. Ventricular tachycardia (VT), a rapid heartbeat originating from the ventricles, which can deteriorate into VF, leading to arrest. 3. Asystole, a complete absence of electrical activity in the heart, also known as flatline. This is often reversible without immediate intervention. 4. Pulseless electrical activity (PEA), a condition where there is electrical activity in the heart but the heart fails to contract and produce a pulse. Causes 1. coronary artery disease, heart attack. 2. Arrhythmias, example ventricular fibrillation. 3. Severe electrolyte imbalances. 4. Cardiomyopathy, heart muscle disease. 5. Trauma or physical injury. 6. Drug overdose. 7. Congenital heart defects. 8. Hypoxia, lack of oxygen. 9. Severe blood loss. 10. Hypothermia, extreme cold exposure. Risk factors. 1. Age. Older adults are at greater risk. 2. Coronary artery disease. A history of heart disease or heart attack increases risk. 3. Family history. Genetic play a role with a family history of heart disease or arrhythmias being significant. 4. Heart conditions. Heart failure, previous arrhythmias or cardiomyopathies increase risk. 5. High blood pressure, hypertension. 6. Smoking, alcohol, drug abuse. 7. Obesity and physical inactivity. 8. Diabetes. 9. Stress and mental health issues like depression or anxiety. Complications. 1. Neurological damage. Lack of oxygen can lead to brain damage or irreversible brain death. 2. Organ failure. If blood flow is not restored quickly, other organs like kidney, liver, and lungs may begin to fail. 3. Long-term disability. Survivors may face neurological defects or reduced quality of life. 4. Cardiac injury. Repeated or severe cardiac arrest can lead to prominent heart muscle damage. Pathophysiology. Cardiac arrest is typically caused by an electrical malfunction in the heart, disrupting its normal rhythm. The lack of coordinated electrical activity prevents the heart from pumping effectively, resulting in no blood flow to organs and tissues. This ischemic lack of oxygen can lead to cellular injury and death, affecting all organ system. Below is step by step breakdown. 1. Initiation of electrical disturbance. 2. Disruption of normal electrical condition. 3. Rapid chaotic electrical activity. 4. Absence of coordinated heart conditions. 5. Loss of heartbeat. 6. Cessation of blood flow. 7. Hypoxia. 8. Loss of consciousness. 9. Absence of a pulse. 10. Activation of autonomic nervous system. 11. Electrolyte imbalance. 12. Acidosis and metabolic derangements. 13. Progression to organ failure. 14. Neurological damage. The brain is primarily sensitive to oxygen deprivation, and after 4 to 5 6 minutes without blood flow, significant neurological injury and damage occur. This may lead to permanent brain damage or brain death if circulation is not restored. 15. Recovery. If cardiac arrest is not treated quickly with defibrillator or advanced resolution measures, death can occur. If intervention is successful and blood flow is restored, the patient may recover, though with potential neurological defects or other organ damage, depending on the duration of the arrest. The progression of cardiac arrest emphasizes the need for immediate intervention, including cardiopulmonary resuscitation, CPR, and defibrillation to restore circulation and prevent irreversible damage. Signs and symptoms: 1. Sudden collapse. 2. Absence of pulse. 3. Unconsciousness. 4. No breathing or abnormal gasping. 5. Cyanosis. Bursting skin, discoloration. A diagnosis: 1. Clinical assessment, absence of pulse, unresponsiveness, and apnea. 2. Electrocardiogram ECG identifies arrhythmias like VF, BT, ACE, systole, or PA. 3. Laboratory test includes electrolyte levels, cardiac biomarkers, and arterial blood gases. 4. Imaging studies, electrocardiography, ECG, or CT scan to determine underlying causes. Nursing diagnosis: 1. Ineffective tissue perfusion related to loss of cardiac output. 2. Impaired gas exchange related to apnea or respiratory dysfunction. 3. Risk for neurological impairment related to hypoxia. 4. Anxiety or fear related to recurrent events. 5. Deficient knowledge about cardiac arrest and prevention measures. Management: immediate medical management. 1. Basic life support, early recognition and activation of emergency response systems, high quality chest compression, use of automated external defibrillations. 2. Advanced cardiac life support, ACLS, defibrillation for VF and VT, administration of medications, example epinephrine, and amiodarone, airway management and ventilation. The nursing management, one, monitoring vital signs and cardiac rhythm continuously to ensuring adequate oxygenation and ventilation. 3. Providing emotional support to the patients and families. 3. Educating on lifestyle modification and medication adherence. 4. Coordinating post-arrest care including rehabilitation and follow-up. Treatment options. First option, defibrillation, key intervention for shockable rhythms, BF, BT. 2 medications, epinephrine, amiodarone. 3. Therapeutic hypothermia reduces neurological damage in survivors. 4. Implantable cardioverter defibrillation prevent recurrent arrhythmias. 5. Corrective surgery for structural heart defects or coronary artery bypass grafting, CABG. Psychosocial medicine, 1. Emotional support for the patient and family members. 2. Stress and anxiety management techniques, example mindfulness, relaxation exercises. 3. Counseling or psychotherapy for coping with trauma or fear. 4. Social support groups for survivors and caregivers. 5. Education and reassurance about recovery and lifestyle modifications. Prevention, 1. Adopting a heart healthy lifestyle, balanced diet, regular exercise, and smoking cessation. 2. Regular health checkups to monitor and manage risk factors. 3. Medication adherence for chronic conditions like hypertension and diabetes. 4. Educating high risk individuals about warning signs and emergency measures. 5. Widespread availability and use of AEDs in public places. In conclusion, cardiac arrest is a life-threatening condition requiring rapid and effective intervention. Awareness of its causes, risk factors, and management strategies is crucial for reducing mortality and improving outcomes. Preventive measures combined with advancements in medical and nursing care play a pivotal role in managing this critical condition. Thank you. Have a nice day.